Hello students, this is the pharmacology lecture on chapter 10, fluorides. Fluorine is a naturally occurring element found in living and non-living things. When a fluoride ion combines with a sodium ion, the compound sodium fluoride is formed. In dentistry, fluoride is added to water and in mouth rinses, toothpaste, and supplements. There is no recommended intake value. Water fluoridation has employed any one of three fluoride-containing chemicals: sodium fluoride, sodium fluorosilicate, and hydrofluorosilicic acid. Much of the controversy surrounding water fluoridation revolves around the use of hydrofluorosilicic acid, which is a byproduct of manufacturing and has been shown to be toxic. Fluoride is absorbed and taken up into the plasma of the bloodstream, which then circulates throughout the body to bathe the bone. Once in the saliva, it can remain chemically active for up to 3 hours, effectively bathing the teeth. Fluoride is retained by the body in the hard calcified tissue such as bone and teeth and is excreted through the kidneys in the form of urine. Fluoride is found naturally occurring in tea, seafood, chicken, and some water such as seawater and well water in areas that had previously had volcanic activity. It is important when considering fluoride content in processed foods. Fluoride can be used as an antimicrobial, anti-caries, and to treat osteoporosis. The amount of fluoride added to water is 0.7 to 1.2 parts per million in order to have the maximum reduction in dental decay without causing fluorosis. Topicals are applied to erupted teeth in home or self-applied fluorides, or can be applied in the office. Self-applied toothpaste contains sodium fluoride, sodium monofluorophosphate, and acidulated phosphate fluoride. A single ribbon of toothpaste on a brush will yield about 1 milligram of fluoride when released, and a child can ingest up to 0.3 milligrams of fluoride in a single toothbrushing session. Self-applied products include mouth rinses, which are either prescription or over-the-counter. The prescription contains sodium fluoride at concentrations of 0.05% for daily use, which delivers 264 milligrams of sodium fluoride or 120 milligrams of free fluoride. Over-the-counter products are available that have a low potency and some have a higher potency. There are also home brush-on gels that are available by prescription. Professionally applied fluoride comes in the form of solutions, gels, or foams that are applied in trays or painted on. It is usually neutral sodium fluoride at 2%, which delivers 9,000 parts per million of fluoride in concentration and is applied twice a year, or as the caries risk assessment indicates. Acute toxicity refers to the rapid intake of an excessive dose of fluoride over a short period of time. Depending on the dose ingested, this can result in mild nausea, upset stomach, or even death. Upon ingestion of the fluoride compound, a chemical reaction takes place where the atoms dissociate into hydrogen and fluoride, making hydrofluoric acid. HF is one of the strongest acids that can be made and is highly irritating to the stomach mucosa. Pain and vomiting will result even if the quantities ingested are small. A dose of 4 to 5 grams on average is such a lethal level that there will be systemic symptoms, which could include muscular weakness, spasm, paresthesia, CNS depression, bronchospasm, ventricular fibrillation, and cardiac arrest. Death can occur within 4 hours after the lethal dose is ingested if emergency actions are not taken. The blood toxicity can reach its maximum level within 30 minutes, meaning the symptoms can begin soon after ingestion. If there is an overdose, the person can be given calcium in the form of milk, or they can be given orally soluble calcium, and one must seek immediate assistance. A lethal dose of fluoride is the amount of fluoride that is likely to cause death if not intercepted with emergency treatment. This image shows a quick drug guide that lists the systemic fluorides and the topical fluorides that are available. This concludes this lecture for Pharmacology, Chapter 10.